Thank you for joining us for another edition of Icon Medical Billing Industry News. For a free assessment of your medical billing needs, please contact us at 888-678-5597 or at our website, iconmedicalbilling.com. Today's topic is, are you ready for the ICD-9 code changes? Considering that practices need to look at billing methods, computer systems, and patient welcome packets, D-Day is a lot closer than you may think. There is no easy way to get a practice through the implementation of ICD-10. Preparation is the key. If your Y2K was crazy, the new 5010 medical billing coding system is far more intense. Information systems, policies, and even the welcome packet of patients will need to be updated. Physicians need to learn the gradations of ICD-10 from ICD-9 code. There are major impacts on both the business and clinical aspects of the practice that need to be updated. Providers must consider looking into the financial aspects of training, upgrading, or changing systems, and budgeting for operating capital in case problems arise, like not being paid for a while in 2013 or 14. The level of detail involved in documentation and billing may decrease reimbursement and productivity if not addressed properly. Practices must plan to do a lot of training for billing staff and physicians, since the transition from ICD-9 codes to ICD-10 codes or 5010 medical billing codes, need a steep level of notch in accurate medical coding. Other practices must pay attention to upgrading computer systems, go through charting templates, and incorporate all nuances of ICD-10 into the templates. More importantly, practices in medical billing departments need to ensure that each item the providers select has the proper codes behind it to populate the bills successfully. Currently, the greatest problems with changing codes from ICD-9 codes to ICD-10 are the uncertainties in the implementation and how they can be handled. One issue is that not all the codes have been frozen. Therefore, tasks such as bill modification or getting EMRs programmed were never initiated. The last annual update to both ICD-10 code and ICD-9 sets was in October 2011. In October 2012, limited code updates, as expected, captured only new technologies and diseases to both the ICD-9 and ICD-10 code sets. There will be a very limited code update on October 1st, 2013 to help ease the final transition. ICD-9 will not be updated as it will soon be underutilized, not utilized at all. Regular updates to ICD-10 will commence on October 1st, 2014. There is plenty of general work to be done, like putting operating systems in place, budget development, planned training sessions, and reworking procedures and policies. The bulk of the work is held at bay until the transition from ICD-9 codes to ICD-10 codes are completely implemented. The practice owners and partners should also look into their financial planning strategies. The true danger to the sustainability of the practice comes when payments cease to flow ICD-9 code protocols despite ongoing outlays for software, training, and equipment. How well the transition will go remains a skeptical view. Some speculate that it will be like Y2K, where most of the quirks are successfully worked out during the run-up and D-Day passes with not much fuzz. It is suggested that cautious physicians should reserve an equivalent of 6 months of income through loans, savings, credit lines, or some other financial methodology, since being prepared is just part of the whole equation. Other experienced practice managers suggest maintaining constant communications with their clearinghouses, payers, and vendors, making sure they are trying out their programs. Version 5010 gives a clear notion of what to expect in October of 2013. Having eyes focused on the big picture is important. Avoid beating deadlines.